Hello there. Why are the mucous membranes of my dog anemic? This is video 2 in a 3-video series that discusses anemia in dogs. In this video, we are going to cover acute blood loss anemia, sub-acute blood loss anemia, chronic blood loss anemia. So let's look at acute blood loss anemia. Most dogs involved in a car accident or mauled by another vicious dog are already in choke by the time they arrive in the hospital. So what is choke? Choke is a state where the dog's body is experiencing insufficient flow of blood and oxygen throughout its tissues and organs. The common cause of choke in dogs is a sudden loss of blood or hypovolemia triggered by a car accident or severe dog bites. Other causes of choke are defects in the heart itself or in the distribution of blood through the blood system or intravascular system. What are the clinical signs of a dog in choke? Always be aware, the prevailing clinical signs will always mirror the volume of blood the dog has lost. So, number 1, you have a visible bleeding wounds. You may have internal bleeding. You may have pale, dry, and anemic mucous membranes. You have cold extremities, all the toes and the front and the back, they are very cold. You may have low temperature. You may have disorientation. You may have increased heart rate and breathing. And you may have unconsciousness. If a dog loses 30 to 40% of his blood volume, chances of survival are extremely slim. Your veterinarian will assess the level of choke and other injuries and determine the right treatment for your dog. Now let's look at sub-acute blood loss anemia. In this group of sub-acute blood loss are parasites that directly attack and destroy or hemorrhage red blood cells, causing hemolytic anemia. Examples are Babesia canis and Trypanosoma brucei. The clinical signs associated with hemolytic anemia are anemic or jaundiced mucous membranes, lethargy, weakness, anorexia or loss of appetite, and fever. Immune-mediated hemolytic anemia or IMHA is a condition where the immune system stops recognizing the red blood cells as its own and forms antibodies to hemorrhage the red blood cells. The clinical picture is similar to that of blood parasites. All the above hemolytic conditions are treatable, and your veterinarian will use appropriate diagnostic to differentiate and treat the one involved. As stated before, hemolytic anemias are regenerative and will trigger the bone marrow to replenish the lost red blood cells. Now let's look at chronic blood loss anemia. Any parasite, external or internal, that sucks blood from the dog will cause chronic blood loss anemia. Fleas, ticks, and hookworms are examples of parasites that cause chronic blood loss anemia. Other causes of chronic blood loss anemia in dogs are gastric ulcers and breathing tumors. Chronic blood loss anemia is non-regenerative, or the bone marrow does not respond to that blood loss. That's the end of this video. If this video was helpful, subscribe, share it, comment, or ask a question below. Thank you for watching, and see you in the next video.